I think as a starting point for me, we have a wellness council at City Hall. Unfortunately, it's not funded. It has a budget of less than $50,000. I would start with trying to put a little bit more money there, because I think if we have a healthy, well workforce, we save money down the road. Second thing that I would do is I try to make sure that there is let's take that adequate back. There's an expansive network of diagnostic testing available at the city worksite. Those of us who suffer from hypertension ought to be able to check it at work. Those of us who suffer from diabetes problems ought to be able to check it at work, and kind of down the road. Third, and most importantly, I would have a major education program at City Hall, complete with initiatives that would really reach out to city employees to talk to them about how important it is for them to take care of themselves and take care of their families. That almost treat it like it's a religion, that this is something that the government's not mandating, but we surely are highly encouraging you to get involved with.
What we need to do is we need a new philosophy of conversion to a healthier lifestyle. One of the things I would do is, one, use technology. Being a Harris County School Trustee, I've already studied how we can increase healthy children by having new technology that could be used with telecommunications, a doctor on the other end, but you could be able to do the simple things for prevention, temperature, skin sensitivity. You could check everything remotely, and we can start doing that within the departments. But I also want to make sure that we change that philosophy. For example, I mentioned smoking earlier. I really believe that we need to change that. We banned that from buildings, but individuals can still smoke outside, 100 feet away, or at home. But they're Americans, they have that choice, but not at the expense of taxpayers. They should pay more in copay, and they should contribute more for that health service.
City employees have a wellness council. I served on that wellness council when I was on city council as the council representative. I also served on the health benefits committee of the city of Houston, so we negotiated our health benefits with our insurer. Mayor has a role as a leader to lead by example. One of the most embarrassing moments of my 12-year political career was doing a public weigh-in in the horseshoe in front of in city council, because we entered into a weight loss challenge. The city council decided to lead by example. We challenged the city of Houston a few years back when we were considered the fattest city in America. Ladies, weigh in with a camera focused on the scale. That will give you incentive. Those are the kind of thing the mayor needs to do, but there are practical things as well. Bike racks at city facilities, showers at city facilities so that people can walk on their lunch hours. There is a weight loss and exercise group that meets in my conference room of the controller's office, of controller's employees, so that they support each other, any and all. Thank you.
This is an important issue where the city of Houston and its government, particularly the mayor, has to take a real leadership role, and it's not just business as usual. I think we've got a crisis here, and what we need in the city of Houston is a mayor who will lead a movement toward health and wellness of a magnitude that we have not seen before. So we've really got on a lot of areas, including public outreach, behavior patterns in city departments, events outdoors, getting more and more people involved in healthy activities and promoting health and wellness. These are the things that we must do better if we're going to become a truly healthy city. I think there's another dimension here where the city needs to be a model, and that is that we really need to care and do something about how our city grows and develops. If we've got neighborhoods that don't have sidewalks, folks, people are not going to walk. They're not going to get out. Our kids are not going to be healthy. If we don't have parks in neighborhoods that are destinations for people to get out and walk, individuals and families, we're not going to be a healthy city like we should. It's a lot of things, and I think it's also imbuing in people and families a sense of personal responsibility, that it's our job, it's all of our job to make ourselves, our families in our neighborhood and our city safe. And with a new program, a new ambitious program of health and wellness, preventive care in the city of Houston, we can be a model for the rest of the city. And I think, folks, it'll work.